In this podcast episode, Dr. Rahul Jandial, a neurosurgeon and author, offers a glimpse into the inner workings of the brain, with a special focus on dreaming, consciousness, and human behavior. Dr. Jandial begins by revealing an intriguing practical aspect of neurosurgery, specifically the existence of left-handed surgical instruments. These are tailored for left-handed surgeons to optimize the mechanics of handling graspers and needle drivers, which traditionally cater to right-handed individuals. The design nuances, such as the direction of the release mechanism or the direction serrations lean on scalpels, highlight how specialized and precise surgical tools must be to accommodate subtle ergonomic differences. This insight exposes the meticulous craftsmanship and consideration involved in surgical practice, far beyond what most people imagine. Beyond tools, Dr. Jandial emphasizes that surgery itself is less about rote steps and more about finesse and artistry. Good surgery at its core is akin to delicate sculpting or ballet. It requires a kind of dance-like flow. The surgeon must gently separate layers of tissue, like membranous webs, with careful spreading rather than tugging, minimizing trauma and bleeding. This elegance and finesse ultimately lead to better patient outcomes. It is a dynamic process where skill, intuition, and precise control merge, challenging the common misconception that surgery is purely mechanical or formulaic. One of the episode's most captivating themes is Dr. Jandial's exploration of liminal states, hybrid transition zones in consciousness and environment where things are neither fully one state nor another. Using the example of the halocline, a blurred mixing layer where fresh and salt water meet in underwater caves, he introduces the idea that transitions in brain states such as waking to sleeping, or consciousness entering and leaving dreams, are gradual and fluid rather than instantaneous. Dr. Jandial maps this concept onto brain function, noting the several liminal phases in a 24-hour cycle. The transition into sleep, the dreaming state itself, lucid dreaming, and sleep paralysis. These are neither fully waking nor fully sleeping conditions, but blend awareness and unconscious processes. The significance of these states is far-reaching, offering a deeper insight into cognition and emotional regulation. They also relate to conditions like narcolepsy or psychosis, where boundaries blur more dramatically, challenging our understanding of reality and self. Central to the conversation is a detailed examination of dreaming from a neuroscientific perspective. Dr. Jandial explains that, contrarily to old assumptions, the brain remains intensely active during sleep, particularly in REM, rapid eye movement sleep, when dreaming is most vivid. The dreaming brain exhibits electrical activity comparable to waking brain states, but differs in the balance between brain networks. The executive network, responsible for logic and control, is dampened, while the imagination and emotional networks become fully liberated. This shift explains why dreams are so hypervisual, emotional, and illogical. Dreams allow the brain to exercise imagination freed from the constraints of daytime executive control, preserving mental flexibility and creativity. Critically, he argues that dreaming maintains emotional and cognitive complexity by balancing two distinct brain modes, one focused on practical task execution, the other on creative simulation, ensuring preparedness for novel situations in waking life. Dr. Jandial offers a compelling thesis on nightmares, particularly their universal presence in childhood development. He presents evidence from longitudinal studies showing that healthy children universally experience nightmares starting around ages 4 to 6, coinciding with the emergence of social cognition and the default mode network, an essential brain system for self-reflection and understanding others. Nightmares, he proposes, function as a mental tool for cultivating the child's sense of self versus other, helping them to delineate their boundaries in a complex social world. While distressing, these early nightmares do not generally lead to lasting disorders, and instead represent a natural developmental phase. This insight reframes nightmares not as pathological, but as adaptive, integral elements informing psychological resilience and social awareness. The conversation also covers the almost universal experience of erotic dreams, which appear during adolescence and often precede physical maturity. Dr. Jandial highlights that these dreams correlate with neurological changes in how sensory information is processed, marking a shift where ordinary touch can become erotically charged as new erogenous zones are perceived by the brain. These dreams are not random fantasies, but seem to serve as a mental rehearsal and preparation for adult sexual behavior and procreation. The content often includes themes of infidelity, frequently involving familiar but problematic figures like a disliked boss or family members, hinting at evolutionary and psychological complexities regarding social relationships and reproduction in human societies. Erotic dreams, like nightmares, are culturally ubiquitous and appear to reflect deeply rooted brain mechanisms shaped by evolutionary pressures. A significant point in the discussion is the phenomenon of dream recall and the degree to which we are conscious of dreams. Dr. Jandial posits that remembering dreams is like capturing fleeting solar flares, residues of intense brain activity leaking into waking consciousness. He ties this to the brain's autobiographical memory system and the construction of selfhood, suggesting that the boundaries between dreaming and waking memory are fluid and that we exist in overlapping liminal states. This perspective also helps explain why some people experience lucid dreaming and why it can be influenced pharmacologically. Dream recall and consciousness provide a rich, albeit complex, portal to explore subconscious emotional states, though recalling dreams is not necessarily by design, but a natural byproduct of fluctuating brain dynamics. Dr. Jandial expresses skepticism toward universal dream interpretation, emphasizing the deeply subjective nature of dream imagery. He argues that symbols within dreams, such as bridges or snakes, cannot have static, universal meanings detached from the individual's personal history, emotions, and current life context. Instead of relying on external interpreters or symbolic dictionaries, he advocates for introspective exploration, where dream imagery becomes a gymnasium for mental and emotional rehearsal. While dreams can offer valuable insight into personal concerns or conflicts, their interpretation is best performed by the dreamer grounded in self-knowledge rather than by external authorities claiming universal truths. A crucial neuroscientific concept uncovered in the dialogue is the dynamic interplay between the executive network, dominant during waking, logical tasks, and the imagination network, dominant during dreaming and creative states. Dr. Jandial relates how dampening the executive network through injury, alcohol, or certain neurological conditions can paradoxically unlock hidden artistic or creative talents. Real-world strategies to harness this creativity revolve around liminal states, such as the moments on waking or just before sleep, when executive control is diminished, but consciousness is still present, facilitating idea generation. He stresses the importance of cultivating these moments through meditation, relaxed focus, and non-directed thought, dismissing the notion that creativity can be forced deliberately under pressure. Dr. Jandial discusses cutting-edge therapeutic techniques like transcranial magnetic stimulation, TMS, which use targeted electromagnetic pulses to modulate brain activity non-invasively. The technology is being applied promisingly to treat conditions such as depression, anxiety, and obsessive-compulsive disorder by fine-tuning neural circuits, especially in the prefrontal cortex. He is cautious about the commercialization of such devices, warning that legitimate clinical protocols involve intense, carefully administered treatments that cannot be replicated by inexpensive home gadgets. Nonetheless, TMS represents a hopeful advance in mental health care, blending neurobiology and therapy into integrative treatment paradigms. Looking beyond dreaming, Dr. Jandial underscores the enormous role lifestyle plays in preserving brain health through aging. Although genetics provide some predisposition, lifestyle factors like vascular health, diet, exercise, and cognitive challenge have significant influence over cognitive decline or resilience. He advocates for a mind diet rich in plants and fatty fish to nourish myelin sheaths, critical for rapid nerve signaling, emphasizes the benefits of intermittent fasting and metabolic switching to ketone utilization, and highlights the importance of movement, even simple standing or walking, to maintain arterial health. Additionally, engaging the brain through intellectual challenges and creativity is vital for sustaining neural networks and cognitive flexibility over a lifetime. Dr. Jandial draws on his extensive clinical experience with terminally ill patients to reflect on profound life lessons. He observes a consistent focus among patients nearing the end of life on reconciliation, forgiveness, and valuing relationships and presence with loved ones, transcending material concerns. He stresses the cyclical, nonlinear nature of wellness and coping, emphasizing that capacity to face challenges is cultivated in advance, with mindfulness preparing one for difficult moments. His insights highlight the necessity of ongoing psychological and physical resilience building, as well as compassionate acceptance of the human condition's vulnerability.